Okay, so we have a part 1 and a part 2. This is NUR 300, Contemporary Nursing, Issues, Trends, and Management. This is week 3, part 2. I do apologize. So we will pick up with collective bargaining process. Collective bargaining is a method of equalizing power. As such, it involves negotiation and administrative agreements between employees and employers. Because this individual employee or even a small group of employees has limited power to bargain with the employer, banding together in a union gives the employees a stronger voice to negotiate with management. The goals of collective bargaining are achieved by imposing rules regarding how employers must treat employees represented by a union. The union movement in the United States is involved with strengthening a worker's position in the relationship between management and labor. Nurses and nurse managers need to understand the steps involved in the union organizing an election process, as well as what are considered appropriate or inappropriate management responses and labor responses. Because union organizing involves power sharing and sometimes a temporary sense of distrust between direct care nurses and management, it can become an anxious and emotional process. Knowing all the allowable patterns for the process of union organizing can help alleviate some stress. The following discussion is an overview of the general steps in the union organizing process based on information taken from the Basic Guide to the National Labor Relations Act. The reader will see that careful attention is given to ensuring fairness for employer, employees, and the unions that may be involved in an election to determine whether employees agree to unionize. Although this discussion provides a general overview of the union election process, readers are encouraged to visit the NLRB website for more detailed information about the union election process. Unions and professional nursing. Professionalism versus unionization. Nurses in the workplace are buffeted by cost cutting, nursing shortages, shuffled duties, concerns about patient safety and quality care, and hospital reorganizations that bring job security and uncertainty. Despite these troublesome working conditions, it is often problematic for nurses to come to grips with their feelings related to emotionally charged issues associated with unionization. Many nurses may be reluctant to become involved with what they view as troublemaking groups who aggravate the issues just to win the contest against the adversary, which is management. It is difficult to reconcile feelings of professionalism and service with the perceived connotations of strife and discord associated with unions. In addition, nurses who try to update their thoughts about unionization through reading finds that it becomes difficult to find objective read-in material. Few experienced authorities on collective bargaining can remain neutral or objective. It is challenging to read about unionization without encountering biased language and the attempt to paint one side or the other in extremely unflattering terms. This situation does not help clear away the fog of conflict surrounding unionization decisions for nurses. Nursing unions and interprofessional teamwork. Nursing may be the only professional occupation in a healthcare setting to be represented by a union, occupational unionism. Unfortunately, having unionized nurses working alongside employees, such as pharmacists and therapists, who are not represented by unions may create ill will between two groups. The benefit package for nurses represented by a union can be different from, and likely better than, the benefits package from other employees. As employment and practice issues rise, nurses have union representation as their go-between to work with management, whereas other disciplines work directly with management to resolve issues. The union contract for nurses benefits will increase the overall cost to the organization, forcing the organization to cut in other areas not controlled by the union, such as benefits for non-unionized health professionals. Imagine how the relationship between the two professionals might be strained if the nurse represented by the union has more paid time off or more frequent salary increases than a colleague he or she works with on a daily basis. Plus, the non-nursing professional knows that the cost of the union contract may be the reason he or she is not able to get a salary increase. Relationships between interprofessional team members is a very important issue as nurses consider unionization. Information technology in the clinical setting. Today's clinical setting is filled with a multitude of technological tools and equipment that are used by healthcare providers. Nurses are likely to encounter voice communication systems, handheld mobile devices, robotic pharmacy dispensaries, wearable technologies, and complex computers and EHRs. These records present data in graphs, tables, and charts that may reveal a different story from that told by words and numbers alone. Transforming patient data into meaningful bits of information is merely one advantage of health information technology, HIT. These data can also be shared with other facilities, creating a comprehensive patient record, thereby reducing duplicate services and tests and creating continuity of care. Health information technology across the globe. Health information technology, or technology used to promote the health and well-being of patients and the community, is ever increasing as technology rapidly advances. Consumer-driven demands for greater knowledge and access about care options have driven many of the technology integrations within healthcare settings, including nursing, academia, and practice. Additionally, regulatory and accrediting bodies are requiring or strongly recommending the integration of technology into all aspects of nursing, academia, and practice. Expansion of the internet is also responsible for promoting access to health resources and information. Global integration of technology has advanced the possibilities for networking, education, provider consultation, and disaster response without the regard to geographic limitations. Electronic health records. An EHR is a system that captures, processes, communicates, secures, and presents data about the patient. In addition to capturing patient data, other components of an EHR include clinical rules, patient education materials, evidence-based practice guidelines, and payer rules related to reimbursement. When these elements work together in an integrated fashion, the EHR becomes much more than a patient record. It becomes a knowledge tool. The system is able to integrate information from multiple sources and provide decision support. Thus, the EHR serves as the primary source of information for patient care and quality improvements in the healthcare system. Points of care technology. With advancing technologies and the movement towards universal use of EHRs, there is a greater demand for HIT at the point of care. This means HIT directly at the bedside or within close proximity to the area whereas services are delivered. Point of care technology is no longer non-essential, but is paramount to delivery of safe, efficient, high-quality patient care with access to patient data and evidence-based guidelines. The technology must provide access to past and current patient data, references, policies, procedures, and evidence-based practice literature to guide clinical decisions at the point of care. A variety of technology tools support point of care decision making and documentation, such as handheld computers, tablets, and smartphones. It is nearly impossible to visit a healthcare facility or office and not see providers using mobile technology. These are small devices as robust as laptops or desktop computers, but are more convenient for on-the-go healthcare providers. These systems have wireless internet capability so that the patient information and other resources can be accessed anywhere, anytime, within the confines of the firewall-protected healthcare environment to maintain privacy, security, and confidentiality of the data. Small laptops also allow providers to access pertinent information at the point of care. These laptops are usually secured to a mobile card. So they have names like computer on wheels, COWs, mobile points of care, MPOC, and computer at bedside, CAB. Smartphones and tablets promote evidence-based clinical decision-making at the point of care. These palm-sized computers can restore medical applications and access healthcare journals, calculators, databases, and more through their wireless capabilities. One of the biggest advantages of smartphones is the convenient and quick access to references and tools for patient education and care. For example, nurses can teach patients about tracking their health by using tools on smartphones or display pictures that show proper procedures. A variety of applications are available for managing chronic disease, diet, exercise, and lifestyle choices. Point of care technology is an essential component of nursing as it shifts from a practice that relies on memory to one that emphasizes continuous use as needed resources. This means that nurses must transform from being technical experts to knowledge workers and must rely on the ever-increasing and reliable computer memory versus the overburdened and fallible human memory. Computer-based alerts and reminders provided by points of care technology are helpful in detecting and preventing potential adverse drug events related to drug-drug interactions and abnormal laboratory values. Mobile devices, such as tablets, are being used in many organizations as standards of care to promote safety and quality via enhanced communications among team members. One example is the use of tablets for virtual handoffs. The virtual handoffs use video technology to include the patient and his or her family in the introductions and initial conversations about the transfer, reducing anxiety and promoting rapport. Nurses have found these virtual first encounters help in confirming patient information and promotion of accountability. Mobile health apps are increasingly being used in the clinical environment by providers and patients. One example is the use of mobile apps for home monitoring of infants recently discharged from the neonatal intensive care unit. Home monitoring has traditionally depended on the parent's ability to access, record, and report significant data, which often results in delay or noncompliance in reporting of critical information that leads to complications, even death. With the use of mobile technology, data are collected via the app and securely transferred to the EHR, where nurses and caregivers can immediately review and revise the plans of care. Mobile apps have been found greatly to enhance the home monitoring for such infants to minimize delay in care and reduce at-home mortality. As today's healthcare environment focuses on safe, efficient, effective, and high quality care, access to patient data, standardized protocols, and clinical practice guidelines through point of care technology has become the standard for patient care. Neuroscientists are increasingly focusing their research efforts on the benefits of using secured mobile devices that are compliant with the HIPAA. These research efforts are widely being translated into clinical environments to improve the quality and safety of patient care and contribute to the efficiency and satisfaction of our nursing staff. Information literacy for nurses. The Association of College and Research Libraries, the ACRL, defines information literacy, IL, as the ability to identify an information need, find and evaluate information, assess information, use information ethically, and document. It is dangerous to assume that nurses can rely on memory alone when practicing in a complex, dynamic healthcare environment. Therefore, IL skills are necessary for the provision of safe and quality care as well as evidence-based practice. The IL skill that equips the nurse for the timely retrieval of information necessary to plan, deliver, and evaluate evidence-based care also support independent lifelong learning. Additionally, many leading organizations, including the Institute of Medicine, the IOM, and accrediting bodies, promote the use of technology by nurses at all levels of practice to prevent errors, to enhance care coordination and communication, and to support clinical decision making. Unfortunately, there is a great discrepancy in the levels of IL skills posed by both new and experienced nurses. As a result, many nurses turn to less reliable sources for critical information. Like critical thinking, IL is a concept that must be emphasized within both academic and practice settings. The emphasis includes removing barriers to assessing online information at the points of care and providing ongoing training to nursing staff to improve these competencies. The ACRL published the Information Literacy Competency Standards for the Nursing in 2013. These standards are based on the nursing profession's fundamental values of evidence-based practice and translational research. According to these standards, the information literate nurse is one who defines and articulates the need for information, assesses needed information effectively and efficiently, critically evaluates the procured information and its sources, and as a result, decides whether or not to modify the initial query or seek additional sources and whether to develop a new research process. Individually or as a member of group, uses information effectively to accomplish a specific purpose. Understands many of the economic, legal, and social issues surrounding the use of information and accesses and uses information ethically and legally. Consumer health information technology. Web 2.0 tools such as social media, collaboration sites, interactive websites, and internet bulletin boards or blogs encourage individuals to be more involved and more knowledgeable about their own health. The information that patients and family glean from such sites can be a challenge for providers because as patients are better informed, healthcare providers are required to answer more direct questions. Further, the healthcare provider must inform patients how to be good consumers of health information. Because providers are seen as the experts, it is the provider's responsibility to ensure that patients are well informed in how to evaluate content and to protect the privacy of others while engaged in discussion via the internet or other forms of wireless connection. Health consumers of all ages are increasingly turning to social media for information about health promotion, such as healthy eating, exercise, and ways to reduce stress. Consumers often access YouTube, Facebook, Twitter, and LinkedIn to learn more about health, promotion, and health prevention. Web 2.0 tools are designed to allow any internet user to become an author of content. With the growing number of internet users, content is also expanding exponentially so that one can find information about virtually anything, including the most obscure illnesses, home remedies, procedures, and medications. For this reason, information accessible on the internet may not necessarily be accurate or created by experts. Consumers of information of the internet, especially health information, must be knowledgeable consumers and must evaluate the credibility and accuracy of the source. The following sections provides valuable information about how to find and evaluate web-based information. Future health information technology trends. With technology advancing at warp speed, it is difficult to imagine the future, but some of our current technologies offer some insight about the possibilities. To better understand how technology will shape healthcare, let us review some ways technology is currently shaping our lives. Social media will no longer be a source of informal content. Social media will develop into social platforms with more legitimate data sources than websites. Cloud computing, patient-centered care driven by rapid change and unlimited opportunity will include advancements in gene therapy, immuno-oncology, personalized medicine, artificial intelligence, and wearable digital devices. Gaming will continue to expand health technologies by promoting health maintenance, physical activity, and cognitive skills that may lead to improved behavior. Smartwatches will continue to expand their features and become as ambiguous as smartphones. Mobile technologies that promote health, mHealth, will continue to advance, allowing patients and providers to communicate routinely. The ability of sensors and wearable health monitoring technologies will continue to increase, offering more options to continuously assess individuals. Security is paramount for healthcare data. Future health information technologies will integrate more biometric technology for authentication and security. Biometric technologies use human characteristics such as fingerprints, retinas, irises, voices, and facial patterns to authenticate or grant access to data or information. More and more healthcare information systems are including biometric options to provide an additional layer of security. It is almost incomprehensible to imagine healthcare of 2025 when one considers the evolution in technology and how technology has shaped healthcare since the invention of the stethoscope. As a profession, nurses must understand and manage information technology, promote the meaningful use of EHRs, and teach patients how to use health information wisely. As the largest group of organized healthcare professionals in the United States, nurses have a responsibility to patients and society to continually improve and refine their competencies and knowledge base related to HIT. Findings of multiple studies confirm that nurses in every role and at each level of education practice exhibit large gaps in knowledge and of competencies in information technology. Technology is an essential resource for nurses in their importance of role tracking, interpreting, and improving quality of care, in addition to translating research into practice. Technology continues to change and evolve at an ever-increasing pace. Be a lifelong learner. Take in-persons or online classes. Arrange group in your place of employment to learn more about health information technology in a clinical setting. Review the resources that are available to you and evaluate them to ensure they are valid, current, and based on evidence. If resources are not valid, take action within your facility to replace outdated or inaccurate resources. If the resources are valid, integrate them into your everyday practice. that concludes our lecture for week 3, part 2. I will see you guys in week 4. Have fun, and I will see you later.